plays a vital role in maintaining overall health and well being. It is the science of how the food we eat affects our body's growth, metabolism, and repair. In today's world, where lifestyle disorders and dietary imbalances are increasing common, understanding nutrition is more important than ever for promoting good health and improving quality of life. Hello, everyone. I'm Ipshita Singh.
And I'm Shibani Banerjee, and we are the members of the outreach team. Today we have a special guest join us, Dr. Nisha Bellare, to talk about the topic of nutrition.
Ma'am, thank you so much for taking the time to join us. So, to start off, could you please tell us a little about yourself and your journey in nutrition?
Okay, so I'm Dr. Nisha Bellare and I've done my PhD in clinical nutrition. My majors is clinical nutrition per se. So I have a teaching experience of almost now 16 years. I'm working with SNDT and I have my own practice again, that is 16 years of clinical practice. So wherein day in and day out I deal with not only weight gain and weight loss, but different spectrums of clinical disorders. So all the different organ systems and the diets which are needed for the same. And besides that,
Thank you so
if
much.
I have yeah, I have to just add on to it. So I'm also a registered dietitian from the Indian Dietetics Association. So I have my own licensures to practice in India. Yeah.
Thank you so much, ma'am. So the first question is, what exactly is a diet? Is it only something people follow to lose weight, or does it simply mean the food we eat every day?
Okay, so when I use the word diet per se, it's a very, very different concept for everyone. Okay, so for someone, diet is something where you just start imagining salads and something which is very not palatable and healthy and soups and all kind of ideas you get. So that is what comes to somebody's mind. But if you look at diet's actual definition, okay, it's more about being balanced, okay, in your plate. So there's a very beautiful concept if people check out. There's something known as a healthy plate concept. Okay, so it's known as my healthy plate. Now this particular concept is very different for every country. Okay, so the plate differs for every country. So when we look at India per se, and if you look at people consuming food, so we are a very carb rich eating population. So we consume more of rice and wheat and bread and all of that. So the proportion there of carbohydrate is very, very high. Whereas if you look at the different components where you talk about protein or fat or even something like micronutrients today, where you talk about calcium, iron, and all of that. So all that does not come to our mind, okay, when we look at or think about food. Okay, it's more of carbs. But of course, with awareness, okay, when nowadays people have started reading up stuff, there's a lot of content which is available everywhere on social media. You have influencers, flashing all different kinds of new diets which come to their mind. So there's a lot of trending, happening when it comes to diet. But if you actually ask the definition of diet or what actually diet means, is basically how do I make my plate healthy, okay, or how do I make my plate colorful. So that is the actual concept of diet, and diet necessarily is not about salads and soups. It can be a very typical Indian cuisine, okay, like we have roti, dal, sabzi, and you have your little bit of achar, and you have all the beautiful things like buttermilk and a little bit of salad, or something really yummy to go along with it. I think that is diet, and something which makes your body and soul happy, that is a diet. Okay, and diet is something which should when it comes, when you're trying to follow a diet, it should be a diet which you can follow for lifelong. Because if it's just about something like 3 months, 6 months, using all your willpower and all your ideas into it, that okay, no, I will do this and do that, that's a very temporary version. That's a fad diet, I would say. Okay, we call it as a fad diet. It's not an actual diet. So an actual diet is basically a balanced plate, something which I can practice on a long-term basis. So that in terms of diet is diet. So I hope that answers your question. You let me know if you want me to elaborate on something.
So now building on that, my next question is, what's the single most common misconception about nutrition you hear from your clients, and how do you usually help them reframe it?
Okay. When I just started practicing, of course, with different, ages and probably years and generations, okay, the concept changes. So even something when it comes to something like a misconception about nutrition, that also keeps changing. But if I have to tell you one, which is even common today or prevalent today, it is, oh my God, nutrition, matlab, boring khana or something like that, like there's no oil to be used, there is nothing to be used. It's a very simple concept of bland food, okay, which I have to take. And these days, if you look at the new concepts which come in, like intermittent fasting and ketogenic diet and all of that, so we look at food, as if it's going to really harm you in some way. So it's just like people going for calorie restrictions and only having one meal a day, or not having anything at all, and then just having everything in that one particular meal. So the misconception is I have to not eat when I'm on a diet. Okay, that is a very distorted idea which people have. In fact, it has to be the opposite. So if you actually see, I'll give you a very simple example, I think, which is very relevant to young adults per se, if like your age group or that population, where we say that probably let me just restrict myself to having, let's say, just 200 calories or 150 calories for one meal, and probably that in turn will make me lose weight. But what happens is, if you're having some meal which does not have protein for your lunch, for example, you had something at around 1:30. Okay, it is very natural that around 5:30 or 6 you will start craving stuff. Okay, because it's, without saying, a lack of protein during your lunch time, okay, is going to aggravate your cravings. So you'll go for sweetened beverages, or you want to have processed food, something fried. There's a very typical thing which everybody says that, I'm like, "Mujhe kuch tasty khana hai." And that time during which this sentence comes out is from 5:30 to 7 p.m. So that's very indicative of a very imbalanced diet which you're taking in, which means that proteins are not good. Okay, the quality of protein which you're taking is not good. You're not having enough fiber. Only when you don't have fiber and protein, okay, during your major meals like breakfast, lunch, that is when you start craving for all the tasty food in the evening. Okay, so that's a very clear indicator there. So it's very important. So this, the misconception, like I said, so I'll repeat it again. The old misconception which I come across every time is I have to stop eating. One. Secondly, I have to eat food which is not tasty or palatable. Okay, that is a very different bad concept which people have. So because of which, this is again very important. So we go for different methods like air frying, or probably grilling and all of that. But today, if you actually look at research, okay, these methods are known to be detrimental. Okay, it's not the natural cooking method which we use. So anywhere where water is not present while cooking, okay, so like boiling, steaming, poaching, all of that, those are good cooking methods which originally were used. Pressure cooker and all of that. But today you're going for air frying and all of that. Though we are cutting down on calories, but we are increasing on something which is known as it's known as dietary age. Okay, so there's very new concept which you have, age, AGE. So these are advanced glycogenated end products. So they increase the oxidative stress in the body and cause aging. Okay, so that is also picking up, and people, this, so there's a lot of awareness I feel which needs to be created, because the one more very important misconception, that anything which is not fried and baked, okay, or probably these snacks which are available in the market, zero oil and zero trans fats and all of that, and those crispy snacks which you get in the market, okay, they feel they're oil free, but no, they are loaded with trans fats. Okay, because anything which is crispy will have oil. You can't have a product which is crispy and not oily. So one needs to understand that something which is not fried is healthy always. No, nothing like that. So all those health-based snacks, we really need to, go and check back again whether they're actually doing us good or not.
Okay, so moving on. When a new superfood or major diet trend emerges, as you like said about intermittent fasting or like new elimination diet, what is your
Hmm.
process for evaluating its potential benefits and risks for your clients?
Okay. One thing which needs to be understood is whenever we refer to anybody for a diet, okay, you need to check their credentials because there are a lot of quacks which move around in the name of influencers or all of those people. So you need to check the credentials because what happens is it whatever you use, any kind of a diet which is executed for any person has to be based on scientific evidence, okay, which is basically documented in research publications, that is scientific literature. So that is the most important concept which you need to understand. So all of that should be coming from there. If it is something which is devised by an individual and randomly just if 10 people have had it and they have found some change and all of that and everybody starts having it, that is something which is risky because maybe it can be helpful for people who are already healthy, but people who already have any kind of a problem going on like a hypertension or cholesterol or diabetes or all of that, it's very contradictory to be using. Even something like intermittent fasting, which is very much picking up today, doesn't suit everyone. Okay, so if I look at my clients, like some of them come with a lot of complications after following these diets. Okay, and then they are like, when I take their recall and I ask them what happened, so they go back and you can see that, for the past 6 months, they either followed a keto or they followed an intermittent fast and they shot up their cholesterol levels and they come up with different, high blood sugar levels. So one size does not fit all. That's very important to understand. So if it is suiting me, maybe there's a possibility it may not suit you. So sometimes like people with hormonal disorders, especially girls, okay, you need to be very careful. You can't really have an intermittent diet, okay, if it is not working for your hormones. So otherwise they'll just kind of, worsen the situation. So when you look at that now, how do I understand that, okay, this diet could be good? So when you're referring, you're not supposed to be referring to anything which is available on the media as such or any random article which is available. You need to look for highly scientific journals. Okay, so we do have, 4, 5 of them which are very authentic. So something like a British Medical Journal or an American Journal of Clinical Nutrition. So these are very high standard resources from where you get the matter. So usme there are studies which are carried out like intermittent fasting in obese people for obesity or for losing weight. So there the procedure is given, there the standard protocol is given. Okay. So those are the references which I refer to if I have to follow it for my patient. But to be very honest, I do not follow trends. Okay, so if I see a person who's come to me for losing weight and I take the recall and I understand that, okay, this is the problem. The problem lies that maybe the person is not aware what is healthy and not good. I will deal with the diet in that manner. I will not just start with a keto diet because, that is trending today for weight loss because that is not needed for this patient, maybe. Okay, so one needs to understand that. So that understanding comes with experience and practice. That is very important. And secondly, if I have to use it for my clients, yes, I have to have it documented in the literature. Like, I also am from an academic background, so we carry out n number of researches day in and day out. Okay, so if I am suppose I have worked on a study, okay, and repeatedly come up with some good results there, okay, on those patients, then I may try and I will see, okay, if it is suited for this person, I will use it for that person. But otherwise, just following anything which is there in the media or public domain is very, very risky today. If you look at, the cases, kind of cases which come up, and what happens is because of lack of awareness, people just subject themselves to different kind of, scary diet, something like a, cabbage diet or something like broccoli diet or something like that, and they have it for like 2 months and 3 months. Of course, if you're just having broccoli because you're not having anything else, you are going to be losing weight because you're bringing in calorie restriction. But what are you doing to your other parameters? That needs to be assessed. What you're doing to your renal system, what you're doing to the liver. That is the kind of awareness which we need to create, because it's very very tempting, for a person who's been struggling to lose weight for like 10, 15 years, and suddenly they come up with something where the promises are made where you lose weight in 2 months, in 3 months. So it's very tempting for the individual, but you don't realize the consequences which can follow. So I think there we need to create awareness, plus use resources which are reliable. So scientific literature is one of the best resources which you can use. Secondly, people want to go for a diet, please check the credentials of the person whom you're taking thing from. The person has to have a license to practice. You can't really just go to any random person and do it. So that's very important.
And ma'am, nowadays people often follow diet they see online without consulting experts. So, what would you or your advice to young people who get influenced by those quick trends?
Correct. When we talk about youngsters getting influenced, looking at stuff which is available in the public forum, there are many things which you need to look at. Okay. One, are you doing it because you are having a condition and you're looking out for options, how do I cure this or whatever? If that is the scenario where you're diagnosed with something which is clinical, okay, or medically by a doctor, and you're looking for that, please look out for people who are qualified to deal with this. Okay, so approaching the right professional is very important. Now, secondly, when we look at people who get very much influenced by influencers, which you see on media, or anything which is very random and attractive and tempting, we need to check for body image issues. Okay, because majority of youngsters, I would say, I'm not talking about, of course, there are many people, you have working individuals and a lot of other people coming in. We need to look at the mental health. Okay, and that is unfortunately very much ignored, but it is very much integrated with food today. Okay, today, if you look at studies, we look at food and emotions very deeply, or it's integrated. So the more body image issue or any kind of a mental or emotional disturbance, if it is present, the person tends to get influenced faster. Okay, and what could happen is it could go in the wrong manner. So that is one area. So we need to really create awareness about mental health issues. That's because majority of these people who we see, they're the ones, maybe ridiculed for a very long time for being obese, or being thin, or all those ideas. So you have a lot of youngsters come in. So if you look at it, the actual problem lies in dealing with the mental health, okay, rather than telling the person that ye khana hai, wo khana hai. Because if you see, they're following emotional eating rather than anything else. So if I correct those issues, I see a drastic change in the entire behavior with respect to food. So that is one. And like I said, influencers, fitness professionals, in terms of, you have trainers, okay, who recommend diets and all of that. Those, they are not trained for diet. Okay, diet is very different from training. And when we look at supplements which are available, like protein supplements, creatine or whey protein, all of that, that has got to do with the levels of training. If you are training at a particular level, you need to follow that, which maybe the trainer may recommend you. But if I am only looking at someone who is, for example, who was like an engineer, or some other professional, and just he's just switched over to health and nutrition, and for the past 6 months he's done some crash course somewhere, and then is recommending that, you need to check the credibility again, because just reading up is not enough. You need to see, and you need to practice in a clinical setting and a hospital. You see what consequences are coming in after people follow those diets. Okay, so today, I remember, there's so many cases, like, you have these supplements which are marketed, very very randomly, something like ashwagandha, or
Yes,
different
right,
things, yeah,
right.
for sleep, and and all of that.
Yeah,
What people do is, they don't realize that I need to see if I am suited for taking that medication or not. Okay, and they land up in liver disorders and renal disorders, and then some, we can't really help them much. So sometimes you take these, a lot of people take concoctions, I don't know, some random natural concoctions for weight loss. Okay, so there are mixes of, I don't know, different kind of leaves and blah, 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 whatever. So we see a lot of, people going in for renal failure and all of that, because that's sometimes there was one case where the entire liver was, full of metals. Okay, and the reason was consumption of natural, so-called naturopathy medications, which were done. Okay, and not even from a actual practitioner, but just randomly checking out, Insta and YouTube and all of that, and just taking in mixtures. So, very much. So the awareness has to be created. So it's like you will get millions of things on Google also. Okay, sometimes
That's so
the
true, mom.
yeah, it's so
Yes,
funny. If
right.
you like kind of, type your symptom on Google, eventually it'll lead to cancer, something like that. So from there, so even when it comes to food,
I think
people
many of us underestimating how harmful those trends can be without
that's what I'm
expert
saying. Yeah,
guidance.
yeah.
Yeah,
Correct, because
right,
today we have AI. Okay, AI
right,
has taken over. So it's like, you have these apps where you just put in your data and everything flashes and your diet is there. But you don't
right.
understand where the diet is coming from. The data is collected from thousands of individuals who've just put in their own data. Okay, so that's coming from there. It's not from a human mind who has analyzed what is good for you and what is not,
Mhm.
and then given you. So I think there we need to really create a lot of, hype that,
Mhm.
what needs to be followed and what.
I agree, completely agree.
Yeah.
Okay, so moving on. In today's fast-paced urban life, where people often skip meals or rely on processed food, how do geography and socioeconomic factors influence the challenge of maintaining good nutrition amidst India's double burden of under and overnutrition?
I very, very good question actually. If you look at today's trend, when we're looking at, something like undernourished and overnourished, one needs to understand that yes, India was or is still an, developing nation. We need to understand that. So we are midway. Okay, so it's not that there was a time when, okay, we had a lot of undernourishment existing, but today the tables have turned. Okay, even something like people who fall below the poverty line, okay, we see obesity in them as well. Okay, which is very sad, because again the food consumption pattern has changed. And when we look at geography and accessibility in a particular area, the accessibility has really, really improved today. So something like, packaged foods like chips and all of that, which are available in 5 rupees or 10 rupees, they used to be available in urban areas, but today if you go to any kind of a village or you go to an interior part of India, you see them everywhere. Okay, so, and I would also like to share this very interesting study, since we raked up the issue of under and over nutrition. We did a study on the body composition of, tribal children versus urban children. Okay, you will be surprised, but the body fat composition is similar, very similar. Okay, so if you look at the consumption patterns, okay, so I'll tell you where the changes have come. Now, tribals usually, used to consume a lot of millets. Okay, millets and the pele. Okay, when there was no globalization which had occurred, they used to consume millets, and of course, these processed and packaged ke liye to there was no money available, so accessibility was not there. Today what has happened is, the government has even given them money, okay, to grow rice instead of millets, because that changes the entire thing. And plus, in addition to that, I make, these processed foods accessible to them, so you get those 2 rupees or 5 rupees wala drinks, and you get those chips and all of that. So the children, instead of consuming something like, they used to consume raw fruits, okay, from the tree, or some plants or something which are consumed by tribals. Today they just carry that because it's for 2 rupees or 3 rupees. So if we look at the body composition, okay, there's something known as thin obese, okay, which is existing in India today. It's known as lean obese. Okay, the person looks very thin. Okay, the person may be 15 kgs, but they may be carrying a very high body fat composition. So that is how the geography and accessibility with respect to food, these are the changes which have occurred here. Okay, so from consuming millets, we move to rice. From rice, we move to processed. Okay, from and all of that. Even today, if you look at something like snacks, okay, pehle, people used to consume something like chakli or chivda, which is made at home. Those were much better as compared to today. When you go out, okay, you're consuming or you're picking up stuff which is baked or air fried or anything of that sort without knowing what goes into it, because majority of these products which are used, they use palm oil. Okay, so because palm oil is the only oil which can be stored for 1 or 2 months. If you use your regular oil, it will become rancid. You'll not be able to eat it. So that's the
Right.
fact which is used. So see, these are very minor things, but nobody talks about it, and nobody's aware. So even something like biscuits and all of that, they can only stay good because they have palm oil, or they have something like margarine, which is present there. So even if it is marketed as healthy and light and low cal and zero trans, it does have the fat which is present. So I think the earning capacity has also impacted a lot. Okay, today we have every house, every nuclear family has people who are working, so they feel that because they are working, schedules are very tight. Okay, so I will rely on something which is very readily available. Something like instant foods has become very common. So you get, all the subsies ka instant packets which are available, just mix it and put it. But you don't realize the sodium content of that food is super, super high. Okay. One packet of consuming any kind of an instant food is equivalent to 2, 3 days of your sodium regular intake, which is recommended. So that is how impactful these things are. And that is how it's impacting the table. So if you look at undernutrition, now I have an equal combating of overnutrition. I would say overnutrition in terms of calories and bad fat, which is higher, because India still is working with hidden hunger. When we say hidden hunger, it means that I'm having adequate calories, I'm having adequate whatever carbohydrates and all, but I'm not having any micronutrients. So I have no vitamins, no minerals, nothing. So that's the change which we see.
Okay. So, ma'am, many of us as a student have irregular eating schedules. What's one simple habit you recommend we should follow daily for better nutrition? So, ma'am, many of us.
Very interesting for young adults. I think this is some information which actually needs to be taught, and in every institute, whether it is school or colleges or wherever, you need to understand that you have to work with your own meal. So even if their schedules are tight, you're consuming, let's say, just something at 11 o'clock or 2 o'clock or whatever. Of course, timings are important, but sometimes nahi ho pata because lectures run, beyond schedule and all of that. But whenever you're consuming any meal, you have to learn to see that the meal contains at least, so when we look at proportion wise, okay, so if this is like 100%, okay, so it should have carbohydrate, okay, in a moderate quantity. Protein has to be in a higher quantity, and fiber has to be in a very, very high quantity. And good quality fat can come in from nuts. Okay, so I'll make it very simple and try to explain it to you in terms of food. Okay, so when we look at carbohydrate, something that is complex carb, okay, so which has more fiber, nothing refined, so no maida, no rava, and all of that you should be avoiding. You can have oats, you can have your whole wheat, which can be used. You can have millets like bajra, jawar, or whatever can be added. So you can consume that, but that has to be the smallest quantity in the meal. Okay, that has to be in smaller quantities. The largest has to be your vegetables. So either you consume it in the form of salad, or you can just make a sabzi out of it. Or the best thing which works for you guys would be something like a pot rice meal or something like that, or something which is compact. So you mix up everything in one thing, and you can take it. So vegetables can be included there, and you can have some amount of protein. If you're a vegetarian, then you can rely on paneer or soya. If you are a non-vegetarian, then some pieces of lean white meat, that is chicken or fish, can be added, and that should comprise of the entire meal. So this is very, very important. When we look at good quality fat here, of course, you can have some amount of nuts like almonds or walnuts, maybe just very a little bit of handful of nuts which you can carry. If you do not have time throughout the day and only one meal can be had, okay, from morning to let's say 3 or 4, then this is the best thing which you can do. So you have your nuts along with that. If not, then you can just kind of give it in the evening, okay, maybe a handful of it along with something which is high in protein. Okay, so protein ke liye you can go in for people or you guys would also prefer protein bars, okay, but you need to check for the source. Okay, you can read the ingredients, but anything packaged, I wouldn't really advise. Rather than that, you can, if you have access to milk, or you can have, maybe carry yogurt with you, and along with that, or maybe buttermilk or something like that. And along with that, some nuts that would do you good. So any meal, whichever meal you take, preferably stick to 3 meals a day. So breakfast, lunch, dinner, and snacking is something which is optional if you are hungry. Okay, you can carry fruits along with you, which can just be had on the go. So keep my one advice would be keep it fresh, okay, and keep it homemade as much as possible. If you're staying in a hostel or staying somewhere, see to it that the composition of the meal at least looks like this, even if it is completely cooked. So this would be my solution.
Thank you so
Ma'am,
much,
as
ma'am,
you
for your very practical advice.
Thank you.
Yes, continue.
Ma'am, as you mentioned earlier that mental health affects diet. So, in what sense would you like to explain that how our diet would like affect our mental health? How our diet would like affect our mental health? How our diet would like affect our mental health? How our diet would like affect our mental health? How our diet would like affect our mental health? How our
How the diet would affect mental health?
yeah.
Excellent question. Very nice again. You need to understand that in order to have a healthy body in general or a healthy mind, there are two, three things which are very important, which needs to be done. Okay, there's something known as circadian rhythm which you have in your body. Okay, circadian rhythm is the time you sleep, the time you wake up, how many hours of sleep you've had, your quality of sleep, all of that. That is the most important, because I can do very good workout, I can have an excellent diet, but if my sleep is not regular, my sleep is not on time, my body will not be rejuvenated. Okay, and if my body can't repair itself, then what starts happening is there's something like a neurotransmitter in your body which is known as serotonin. Okay, so serotonin is extremely important for your body to make you feel normal. Now what happens is, if I have any kind of practices like eating outside food a lot, and I do not exercise. I have irregular sleeping times. I just sleep for like 5 hours, 4 hours, 6 hours, very erratic timings. The entire gut microbiome changes. So in your stomach, okay, you have something like your gut microbiota, which is very important. Today we talk a lot about gut health. Okay, so 80%, okay, 80 to 90% of serotonin is not secreted from the brain. It is secreted from your gut. Okay, so if I keep my gut healthy with healthy food, with healthy, lifestyle in terms of not being sedentary and being active, automatically the gut microbiome changes. When the gut microbiome changes, I would have good levels of serotonin, which would be secreted. And in addition to that, if I want to secrete good amount of serotonin, I need sleep. It cannot be secreted without that. And what is happening today in young adults is, because the screen time is so much, it is affecting your sleep quality and the release of serotonin. So what happens is, if that's not really secreted in good amounts, you would experience in general physical stress. So it starts with physical stress. So you feel very tired, you feel fatigued, you don't feel good, you feel blue. Slowly and gradually, it starts affecting your mental health as well. You feel blue, you feel a little sad, and then you don't really understand, why am I feeling that way? Okay, there's nothing which has happened, everything is fine, but I'm still feeling, off, or I'm not really in the mood. So that's basically nothing else, but it's your serotonin which is not up to the mark. Okay, and that is causing you. So what happens? It's like chronic. It doesn't happen overnight. Okay, because during exams, for example, you have erratic schedule, like that is still understandable for some days. But if you do it chronically, it will affect your serotonin, it will affect your sleep, and as a result, you're going to affect your mental health. And there is no two way about it. So sleep, I feel, is the most important, indicator. If you need a shortcut to start feeling good, you start sleeping well. And automatically what happens is the symptoms in terms of any kind of a mental disturbance, I would say, whether it is stress, anxiety, or depression, any of these three would start changing. And of course, if it is clinical, then you need help. Okay, one has to go in for therapy. If therapy doesn't work, then a little bit of medication would work, and all of that together with this is going to help you. And today there's one more very important food component which you have in your body, in your diet, okay, which is sugar. Okay, so processed sugar is known to be a killer for serotonin. So though it makes you feel good on a temporary basis, but in the long run it's going to impact. So someone who's very much addicted to sugar would eventually have an effect on the mental state as well. So that has to be eliminated so that everything is in sync. Yeah.
We are also seeing a sharp rise in diseases like diabetes and hypertension. How much of this do you think is actually linked to nutrition compared to genetics or lifestyle factor? How much of this
If you actually go to say, there's something known as a concept of epigenetics, okay, which plays a very important role. So when I say epigenetics, it's the role of environment on your genes. Okay. When I say genetics, maybe in a family line, I would say 10%, 15%, not more than that. Okay. So genetics is not the only reason why someone would be affected by these diseases. And whatever you've mentioned, they are all metabolic disorders, okay, eventually, and they are all non-communicable diseases which happen because of a lot of things. Okay, so usme se lifestyle is one of them, diet is one of them. Okay, and genetics, yes, the person is more prone, could be at risk, but if I change my epigenetics, which is the environment in terms of diet and lifestyle, I can have an impact on decreasing the percentage of risk of having that disease in an individual. So something like today we have something known as preventive nutrition therapy. So we do use that, and if I change my diet in terms of that diet which I explained to you earlier, in terms of that healthy plate and that concept of having everything in place and making it colorful, it will reduce my risk of getting that disease. So we do see these changes. So if I change all of this, I can also work on the condition, and I can avoid the risk of having that particular disease. Absolutely. And so your question would you say 70% epigenetics and 30% the rest of whatever you mentioned.
So, moving on. In today's world, where affordability and advertising strongly influence what people eat, how do these forces shape our everyday food choices and nutritional well-being?
Yeah, like that is what I said. Because what has happened is in the past few years, there has been so much of competition for different food products, okay, all around, that everybody tries to supersede the other. Now, you can only supersede it by making it attractive and, coming up with something which is very, very different. So, something like you would have a celebrity nutritionist, maybe like, I'm sure you'll, I don't want to name the person, but I'll just say some statements. I'm sure you can relate to it. So something like sugar is good. Okay, then Indian sweets need to be consumed, or something like a different line which is just mentioned, and this is good for health. Diabetics can have something like sugarcane juice or something like this, something trendy. So they come up with these things, and what happens is if there's someone who's a lay person, okay, who's not from this background, does not understand nutrition of food, they would say that, oh wow, this is like working. She is saying it. Okay, she is making this statement, which means that it is safe. So chalo, everybody will go and start having it. So I've had a patient who is like come up with shot up blood sugar levels of 600. Okay, and when asked how, like, no, this ex dietitian was very famous. Okay, so she's written it in her book that it can be had every day. So this guy went on drinking like 2 glasses of sugarcane juice every day. He was a diabetic, okay, and landed up with such high blood sugar levels. So you need to understand that this is not something which should be done. So influencers, like I said, even awareness. So I think somewhere at the government level we need to even make it more stringent. Like for example, in UK, sugar is with heavy tax. Okay, so automatically the consumption of sugar goes low. So something like that in India needs to be experimented, because the way people put up their products, okay, so it's like, complete cure, complete reversal of diabetes, complete reversal of something like PCOS and all of that, some weird, weird statements which they come up with. So there we need to put a tab, and majorly, like I said, awareness. And this is for everyone before even starting anything or initiating anything. You need to get yourself checked first. And of course, that advice which should be coming should be from a professional, because other than that, no. And I think somewhere institutes like yours or even mine, okay, we need to come up with a lot of awareness programs. Forget the community, okay, but in the institute itself, there's so much of lack of awareness which just floats around. Okay, so we need to create camps and awarenesses for this. Yeah.
Okay, so the last question. Uh, could you like tell us how poor nutrition is like linked to diseases like type 2 diabetes, cardiovascular disorders, and hypertension?
When we look at metabolic disorders, okay, like type 2 or obesity or cardiovascular, very interestingly, people used to always use this word BMI. Okay. Everybody would say, you're overweight or obese if your BMI is higher. Today, we don't rely much on BMI, okay, because you may be very, very fit, but you may still have a higher weight on the scale because your muscle mass is higher or more denser than your body fat. Okay, so that concept has gone. So now what we check is we check the body composition. And if you look at Asians in general, okay, all of us are very much prone to lipogenesis, which means that I have a tendency, or we have a tendency to generate more body fat. So, for example, I take somebody from some other country like Europe, okay, for example, and from India, and I give them protein in the food, okay. So, this European would synthesize muscle mass, but the same Indian, okay, or Asian would end up synthesizing more of fat out of it if it is not used up. Okay, so it's like that. It's your body. So where you come from, the entire race, the entire genetics, all of that, the lifestyle, all of that. You're more prone to accumulate body fat. Okay, now what happens is, if it is overall body fat, it's fine. But if it is something like abdominal obesity, where you accumulate fat on the abdomen, that is dangerous fat. Okay, that is the one which will lead to metabolic disorders. So something like a gynecoid, or a lower body obesity will not affect you that much as compared to the abdominal obesity, because that is visceral fats. It's covering all your major organs, okay, like pancreas and liver and all of that. So these are the ones which will help you develop these diseases, and these are the major reasons why this happens. And the major reason why a metabolic disease would happen is, of course, consumption of a lot of processed foods, sodium, salt, and fat. They are known as HFSS. So high fat, sodium, and salt intake is something which is responsible for your metabolic disorders. And in India today, because of access, because of affordability, and taste, of course, and variety, people consume those foods, and this is where it goes high. So the risk increases.